Hi, I'm Dr. Mona Masood. I am a Greater Philadelphia area outpatient psychiatrist, and I am the founder and chief organizer of Physician Support Line, a national peer-to-peer support line that's run by um, volunteer psychiatrists nationwide who are unapologetically supporting their physician and medical student colleagues throughout the United States on the many intersections of their personal and professional lives. I am, very humbled to be able to talk to you about my heart's work for the past 3 years and just dawned on me on the physician support line, which really started off from a place of if not me, then who, which was kind of a mindset that I think most physicians can relate with, especially during the start of this pandemic. It was back in March of 2020, which I think we all identify in the United States as being a very crucial time for physicians navigating the pandemic. And it was also the birth of the physician support line because I found, myself discussing with colleagues, not just on this new virus, but also for the first time, perhaps, how we're doing. Yeah, and how we are not only coping as physicians and this new role we found ourselves at, but how are we doing as human beings? It was a conversation that I think we gave ourselves permission to speak about finally during this very huge traumatic time period. And so, what I found myself and what I realized in my work as a psychiatrist is that timing is everything. It's not just about, are we saying the right things, but are we ready to hear it when we're struggling or when we're not wanting to face that we're struggling? And I think what happened was that in March of 2020, physicians really they were overwhelmed and they finally, I think it was that window where they were receptive to this idea that perhaps I need help too. And, as social media was going on, we were all kind of communicating whatever we knew about this virus and how we're coping. And what I found interesting in these conversations were that physicians were telling each other how they felt, but they were saying it in a very intellectualized way. And it was, things like, oh, does anybody have a good lawyer they use for writing a will? Or things like that, which if you can read between the lines, that they're saying that they're worried about their mortality, they're worried about not surviving this and what that would look like. And when I started seeing that and other psychiatrists started seeing that, we were not only alarmed, but we knew that we had to address this before it took over us or it ended us. And I put out one of my own posts in these many social media groups saying, "Hi, I'm just a psychiatrist, and I'm calling other psychiatrists who's interested in starting a support line for our colleagues who are just trying to navigate this pandemic." And the response was incredible, and it just speaks to the generosity of spirit and the sincerity of our colleagues. And here we are 3 years later.
It's really amazing, and I'm so inspired by what you've done, and it is inspirational to think that you reached out to your colleagues and that you had such a strong response from them, enough people that they were willing to be able to staff this line, because your hours are pretty extensive, right?
Yeah. Yeah. So our hours currently are Monday through Friday from 8 a.m. to midnight, Eastern Standard Time. And yeah, they are available for medical students and for physicians on in any part of that timeline, whether you're residents or fellows or attendings or even retirees. Anybody who has a shared experience of medicine is welcome to call that line. And just to kind of emphasize the purpose of this, we are not, this is not a doctor-patient relationship. This is peer-to-peer support. What we share is that we have gone through a very similar experience of, medical school and then training and then the health and navigated the healthcare system and we're peers in that way. You can call about any subject. We have talked about anything from being burnt out, if we even use that word anymore, to our frustrations with the healthcare system in America, also moral injury of what we thought we were going to be as physicians and who we turned out to be, and how that feels like some moral reckoning. And we talk about family, and we talk about marriages, and we talk about loneliness, and we talk about sleep and isolation, and anything under the sun. It doesn't have to be a crisis to call. It really is more important that you're giving yourself permission to center your own story and center your own wellness. And I think that that is something that is so needed.
It is so needed. And so once a physician or a medical student takes that first step and they call and they get some of that sort of immediate feedback and ability to share and process emotions, what's usually the next step for those physicians? Do you see a common theme? Are many of them just needing to have one or two talks, or are they being referred elsewhere? What do you see?
So we have a number of different kind of callers. It's all anonymous. It is free of charge, and we don't report to anyone, and which is a big fear that all of us have regarding licensing and things like that, about this being reported to employers, etc. So we don't do any of that. What purpose this line has, and the sustainability or the continuity that this line offers, is really up to the person who calls in. If the person calls in saying, I just need to vent this out because there's really nobody in my life that understands what I'm going through, then that can be the purpose of the call. If somebody maybe started off that way, but by the end of the call is saying, wow, this was so eye-opening to me on the benefits of working through something, and I didn't even know or wasn't even aware of what I was actually going through. I would like to continue exploring this. Then we have a number of resources, state by state or by nationwide, for continuity of care. And so we can refer people for either therapy or for psychiatric care. We ourselves cannot offer continuity on the line because it is anonymous both ways. And some people are like, maybe I'm not ready for continuing this in a therapeutic relationship, but perhaps I would like, articles or self-help resources, and we can offer that too.
Even though this is a peer support, I think what's really unique is your peers, but you're also, and then some, because you're all psychiatrists.
Right.
So what means a lot to me about that is that I know what a psychiatrist training entails. I know that there are standards. I know that every one of you has passed certain examinations. Comparing that to what I see in the physician coaching world, which may have its place, but we don't know what that necessarily looks like for every individual that's offering that. Can you share a little bit about your thoughts on those distinctions and where it may be better for a physician to actually seek a therapeutic, psychological, or psychiatric relationship versus a coach?
So yes, there is quite a difference between, seeing a psychiatrist or even seeing a therapist, a licensed therapist, versus coaching. Coaching very much this idea of, I'm speaking about a struggle that I'm having. The other person on in this coaching relationship is supportive at most. And what we mean by supportive in the psychiatric community is very different than maybe perhaps we discuss it colloquially. And supportive means, basically just strengthening the strength. Like whatever is a person's talking about, they're trying to like ground them. They're trying to just give them, that kind of the space to talk about things. That is valuable in its own right. We have friendships like that. We have any number of relationships that fill that kind of role. But coaching can perhaps intentionalize that more than a friendship can. So with, with a friend, perhaps, you worry about, oh, maybe I shouldn't keep talking about this one problem. But with a coach, that becomes kind of like the sole purpose of what you're doing with them. But there is not much more that a coach can offer besides empathic ear. And yes, there is space for that and necessity for that. But when we're talking about therapy, when we're talking about, psychiatric or psychological rapport and care, we're talking about support, but we're talking about work. And what that means is that we are trying to move beyond just this place and time, which is very much that's where coaching ends, where it's just really about kind of pulling in that immediate reaction. But from therapy, we're talking about moving forward. What are lessons learned? What are things that we know from our past and our present that have perhaps gotten in the way of ourselves, and how do we overcome that in order to build something further? And that takes a lot of training. And that is a big difference between psychiatric or psychological care than coaching is. Again, we're lucky, and I'm thankful that we have all these different levels of support. But in the end, it becomes about, what is my goal here? Is there something that I want to further? Or is it that I'm just need to feel safe where I am? And so, in that regard, is when I make those differentiations. I do think that therapy can be a very vulnerable place. I think that it really requires sometimes for us to have what I call breakdowns, to have breakthroughs. Like, we have to often, break down preconceived notions or concepts, or teachings, or fundamentals that we may have internalized throughout our lives. And then we have to kind of reformulate and reframe it and intentionalize it towards something that is on our terms, rather than what we have been always taught, either arbitrarily, societally, culturally, religiously, gender, everything. So there are different types of goals associated with therapy, but it really promotes growth.
I love the way you said that. And when I think about physicians as a group, I think about very highly driven people, very self motivated, very much perfectionists, very hard on ourselves, very much people pleasing, and all good qualities, but also qualities that can get in our way if we don't know how to control them, or if they begin to control us. And it's more than just like, okay, set a boundary. Well, why am I having trouble setting that boundary? What is it that is ingrained in me that is making that so hard to do? And so a coach can, help you and tell you to do this, but a therapist can kind of help you get in your head to figure out why you're doing that and have those breakthroughs. And
Yes.
I don't know, I'm kind of this person that thinks everybody that wants to better themselves and offer more to their patients would benefit from this type of a situation.
Oh, absolutely. It is it's something that amongst the psychiatric community we talk about a lot, that therapy, and if not a psychiatrist, at least from therapy from a licensed professional is almost as essential as having a PCP, because we normalize so much that we don't even realize what we normalize at some point, and especially as adults. And so we don't even realize until we start discussing it and hearing ourselves truly. It's remarkable when I ask my patient to explain something, and they're like, "Oh, doctor, I already know what that is." And I said, "But say it." And then when they do, then they catch it. They're like, "Wow, do I really believe that?" And so there's something in the willingness to sit and unpack intentionally, and work through in the safety of doing it with someone who is trained to to for what they're looking for, and how to guide through those kind of moments. That is so incredibly important. I think validation is the other word I use often for what I notice in coaching, that most of that work, again, I'm not saying it's unnecessary, but it's something that is more centered in that work, is primarily validation, which it can be helpful, especially when a person is so used to feeling invalidated. But however, to go beyond that, saying that yes, what you're noticing is happening, you're not wrong, but then what do you do beyond that? And so then, well, how do I learn how to trust myself then? Why do I keep needing external validation? How do I learn to be my own internal barometer? That's where you see therapy kind of taking the reins.
So instead of just validating, you're actually challenging that person, which can be very uncomfortable. But like you said, sometimes you have to get to that place of discomfort to have those breakthroughs.
Exactly, exactly. I think that is what has stigmatized therapy and psychiatry for so long is this kind of inherent idea that it's going to make me feel uncomfortable and vulnerable, and nobody wants to feel that. I understand. I empathize with my patients who come and see me, that this is not ideal in any sort of way, but it is also necessary. And I think we start learning that what is right or what is good does not necessarily feel good. And so those are lessons that have have such important ripple effects in so many parts of our lives, where we stop associating discomfort with bad and just see it as what it is, which is just discomfort. It's actually a neutral. What is it trying to tell me? What is the point behind it? How do I channel that and listen to it instead of always trying to run away from it? And so it is more than just feelings in therapy and psychiatry. It is more than just pursuit of happiness. It is very much a pursuit of balance, learning to live and understand, and channel our emotions into something that feels like it's on our terms.
I love that, and I think about things like growing pains. We have
Yeah.
pain when we grow. We face this discomfort, but that's the process, and that's where you learn. And I think when I think of the word about therapy, is I think about empowerment,
Mm,
because you can, like you said, I love the what you said about having your own internal barometer, and you're actually learning tools that you carry with you, and that you use to continue to develop yourself as a person. So, how do we get this message out to physicians to destigmatize the idea of entering into some type of a therapeutic situation? How do we also get around this concern about repercussions as far as
mm.
licensure or other professional issues?
So, Rebecca, thank you for bringing this up because, we can all preach a pretty game about, being our own self advocate of getting things done, and in an ideal world that would be more doable. It is very real that we have systemic barriers to mental health, and especially for physicians. And that is something else that Physician Support Line has been working on with, Dr. Lorna Breen's foundation, as well as American Medical Women's Association. There's a few organizations that have been working on specifically the mental health questions on medical license applications, where it is unclear the disclosure requirements on these applications. And so much we have, so when we're reviewing these applications, what makes it tough is that there's not one federal licensing. This is all state by state, and each state has its own kind of wording on its applications regarding, mental health. And some of them got it right. So this is not just a doom and gloom idea. Some of them have received and amended their application to reflect something that is an important a distinction in how we view mental health. And I think this will be helpful for even um, ourselves when we're thinking about, am I a good doctor? Is me suffering from depression or anxiety or something all of a sudden make me, incompetent? And that's not the case, because what it actually, the distinction, and that we don't want in practice or seeing patients, is not illness. It's more along the lines of, is it an impairment in going on that is, stopping this doctor from delivering standard of care? So that is very different than a person who has experienced or is going through and navigating illness. And so in that regard, and when we brought that up, there's several licensing boards that have changed their language to say, is there, have you been diagnosed with impairment, or have you been, reviewed regarding impairment rather than illness? And so it's a work in progress. But what I would recommend, instead of just, fearing seeing somebody, is that I would actually look up what's going on in your own state. And where you can do that is if you go to amwa.org, it has Humans Before Heroes is the name of this initiative, and it has state by state. You can click on your state, and it will tell you the language that is used on your board, and what is the most recent update on what they're doing regarding that. And the other ways you can also seek treatment without fear of repercussion is, of course, you can always call us and we can guide you too, but on your own as well. Is that, if you're able to do fee for service, or if you're able to do something that is out of network or something like that, and I know it's not ideal and it's not what it should be, and I recognize that, but that is one way to at least lessen the fear behind this. So yes, we have a real problem. We have a real problem. And that is a systemic issue that's happening. And then within medical culture, we have a problem, right? Which is that we have got, and all of us will nod and agree with this. We all remember at some point, whether it was in medical school or in our training, that we were applauded and acknowledged and encouraged when we did something that was very self-sacrificing, when we gave up something, when we, took the extra call, or or the one who missed out on important things. I remember, like, if a medical student missed out on something important, instead of saying, I wish you didn't do that, I wish you went, and we would have figured it out, we could have found another way to navigate it. They were applauded and seen as being, a real doctor. And so these things are implicit because we don't even realize we're doing that we're applauding self-sacrifice. But it is something that we have all internalized, throughout our training, that the best physician is the one that gives up the most. And I thought what we were actually going into was, it's a physician that gives, but gives and gives up is not the same thing.
So that's such an important message. Is there any kind of red flag or anything specific that you would recommend that doctors look out for, and maybe when they should reach out to a physician support line or someone else?
Yeah, what I actually say is, it's not even the red flags. Look for what I call the pink flags, like even something less than when you would really reach out. Um, and what that means is, you know, the things that, if you're starting to see the things that you enjoy are not as enjoyable, if you're seeing that, the way that the people that you want to be with, you're not wanting to be around them as much anymore, and you're seeing yourself withdrawing, is usually what I notice as one of the first signs that we're not in the best place. It's like, talking to someone, I think we put this big banner like, oh, it's a call for help. Like, we call it something that feels so drastic, but it's actually not. It's just like, um, almost like unburdening yourself, like sharing it with someone else. Like, are you seeing what I'm seeing, or am I overthinking? Where am I? What are you thinking about this? It's just like how we can't treat ourselves as physicians. Like, we can't, right? Like, in the end, we need somebody else to be more objective. It helps in that regard to kind of take it off your shoulders and let somebody else look at it and be like, yeah, you know what? This doesn't sound so good. And so that's when I say, like, reach out to someone. And the physician support line, I'm telling you, like, the calls we get, there are some that are, very overwhelmed and feeling kind of like at the end of their rope. But the majority of the calls are just, I just want to talk about something with somebody who I think gets it. and I just don't know, I just don't know what I'm feeling or why I'm feeling it. And it can be just like it's almost like curbsiding, and it's not a bad thing at all. It has no um there's nothing at stake. There's only it's really, as physicians we talk about risk versus benefits and making informed decisions. There's honestly no risk. It's either it's helpful or it's like you're where you were when you called us. But it's really worth it. I can vouch for every single one of these volunteer psychiatrists. We're all standardized, meaning we're all out of training. You're not talking to a resident or fellow. We're all attending physician level. We're all US licensed. There's not even retirees. We're all actively licensed psychiatrists in the United States. And I can just say, honestly, they're so sincere. They're so generous. Like nobody had to do this. Like they want to. And so you're going to reach somebody that is intentionally there for you. You're not a burden. And I just wanted to conclude with this one thing I've noticed about these calls. When physicians call the support line, is just so telling what happens, like the initial thing that they say, which is, I'm so sorry for taking your time. And I'm just like, oh no, this is literally called a physician support line. This is literally the person picking up knows and has volunteered to do this. There is no obligation on the person even talking to you. So there is no need for apology. But it just goes to show you how unused to and how uncomfortable we are with even, gosh, desiring support.
Or maybe like
It's
feeling worthy of getting help,
yes,
or I don't know.
yes, it's so many of those things. It's so many of these internalized ideas of what it means to be a good physician. At the very least, that's what we can do for you is kind of be there as peers, as fellow physicians, reminding you that yes, you have worth. Yes, what you're doing is incredible, and you as a human being deserve to be well. So at the very least, so that's what I would like to end with. That it doesn't have to be these giant commitments that we talk ourselves out of. It really just had to start with seeing ourselves as worthy of support.
Thank you so very much, Dr. Mona Masood, the founder of the Physician Support Line.